can you briefly break down your understanding of Section 12 and in what order, and how much time would it take for a new doctor who has completed, let's say, MRC Psych, at least Part B, not the CASC exam?
Raja, do you want to take this
So,
one first? And I'll come
uh,
back.
yeah, I mean, this is a it would be difficult to explain to people who I don't know about much about the mental health. Like basically, the section there are basically two different things: Section 12 approval, and then you have the AC or RC approval, which is a higher degree of approval. So consultant level people will have a RC or AC approval, which means that they can become responsible clinician for the patients who are section who are under their care, either inpatient or they are on the community treatment orders in the community. Section 12 is basically made up for doctors who have at least 3 years experience in psychiatry. So Section 12 is like kind of middle grade doctor can become a Section 12 approved doctor. Our SPRs, our ST trainees are usually Section 12 approved, especially doctor graded also can get Section 12 approved. And sometimes you have doctors who are not even psychiatrists, they can be Section 12 approved. Like for this example, if somebody is a GP, they can also become Section 12 approved as well. Section 12 approval is basically that, when you're doing a mental health act assessment, especially in the community, you need two doctors to do the mental health assessment. And ideally, they expect those two doctors to have the Section 12 approval, basically, which in very simple terms mean that you have the understanding of the mental health act, you have experience of psychiatry, and then you have attended the courses for Section 12, which means to gather information around the mental health act and how it works, and what are the rights of the patient, what are the things you should be looking for when you're sectioning a patient. When we use the term sectioning a patient, it basically means that when you're treating patient, admitting patient against their will, to a hospital in very simple terms. So when you first came to UK, you will obviously not have that. It's something that you will have to work towards. And I mean, I've seen people who have come from India or even Pakistan as well, who've come after passing their MRC Psych exam, and then when they were in UK, within the first 6 months or 12 months, they were able to gain those competencies to actually apply for the Section 12 approval, and then gain that. For AC and RC approval, do you need more years of experience? That is something that will come with time, and then when you become a more senior doctor.
Yeah, I think just to sort of add my 2 bits to it, in very, very simple terms, like Raja said, if you want to admit someone against their will, then you need to be Section 12 approved. Section 12 is a section of the Mental Health Act, which essentially, so if you want to admit someone against their will or their consent, then you need to be a Section 12 approved doctor. Now, once they're admitted, if you want to take the responsibility of that patient, to say send them on leave, discharge them on a community treatment order, decide what happens with them, you need to be the responsible clinician. So these are the two terms that we want people to be orientated to: Section 12 and responsible clinician. To become a Section 12 doctor, if you've got MRC Psych, is much more simpler, because with 3 months and your trust supporting you, if you've got MRC Psych, you can become Section 12. Whereas if you don't have MRC Psych, say you've come through the International Medical Graduate route or the PLAB route, from what I know, because one of the people that I'm supervising right now is on that pathway, is you need at least 4 years of psychiatry experience to be able to apply for Section 12 approval. So essentially what Raja said, that you need 3 years or 4 years of psychiatry experience to be able to apply for Section 12. Because if you've got MRC Psych, you would have been in psychiatry for at least 3 years by that point. Then to become an AC, if you've got MRC Psych and you're on the training pathway, then by the time you finish your CCT, you will be on the specialist register, which gives you a direct entry to becoming an AC. Whereas if you're on the other pathway, say you're planning to do CESR or doing CESR, you've got MRC Psych, then you need at least, according to most places, you need at least 7 years of experience in psychiatry to be able to apply for an RC-AC status. So once you become an RC-AC, then a lot of trusts start opening up doors for you to become an ACT-UP consultant or a locum consultant. Which is like, in simple terms, in the terms that is used in India, is ad hoc consultant. So it's not a permanent consultant or a substantive consultant according to the UK appointment, but an ad hoc or a locum appointment. So the understanding is that within those 12 months of them offering you the locum role, you will then complete the remaining formalities to be on the specialist register. So there are these three things: Section 12, which is the first step, AC, which is the second step, and then, of course, being on the specialist register is what leads you to become a substantive consultant. That's where you want to be at the end of the day. Be it through the CCT pathway, all of that is much more structured. If you go through the CESR pathway, all of those things are things that you'll need to navigate a little bit by yourself, albeit if you've got MRC Psych, then Section 12 is slightly easier.
So broadly speaking, Section 12 will allow you to be an on-call registrar and be able to do locums and take responsibility at the registrar grade, while Section 12 plus ACRC will allow you to act at a consultant grade. Am I right with that?
There's exceptions to all of this
Yeah.
everywhere. There's people who are substantive consultants who are not on the specialist register that I'm sure Raja knows, I know. So there are some exceptions to all of those things, but broadly, yes.
So you can still become a consultant, but not being an RC. These are a little complicated to understand, but what we explain is a simpler version of that. There are exceptions to all of these things.